So we came to Philadelphia. Those of you may know, the University of Pennsylvania is the oldest medical school in the country, the first hospital in the country. Benjamin Franklin was our CEO once upon a time. Very historical place. The question was, could you do this in a very traditional academic medical center? Lots of residents, lots of fellows, lots of, quote, smart people, all of whom better than the next. You don't know anything about that, I'm sure, right? All academic medical centers, always better than the best. So there we actually trained 220 nurses in these problem-solving capabilities. Now this is an extremely important point. 2 points. One is nurses are the guardians of patient safety. Empower your nurses. They are the ones that know what the problems are and they know how to fix them. They need your support to be able to do it. When I say we trained, in 90 days we trained 220 nurses in this methodology. We had to observe their work. How did we do that? This is important for leaders to know also. I think we throw a lot of stuff at our workforce and say, learn this. What you need to do is free people's time to learn. So what we did was on the day shift, for the month that we started this initiative, we brought in 1 extra nurse so that each nurse on the 12-hour shift would have time to come off their work and actually learn at the point of care. Not please do this on the knowledge link computer, not do this at home at night, not take your CME hours. We said this was important enough that we bring in 1 extra nurse. Now, I paid for that out of a grant I had. The hospital had paid for it. I got a grant from ARC to do this work, and what I asked for was enough money that I could free the time of a nurse. But that allowed people to say, wait a minute, this guy really cares about us. He actually doesn't want us to take care of 8 patients, 2 admissions, and 6 discharges while we try to learn lean methodology. He wants to give us an hour to learn it. And basically it would take an hour, 90 minutes away from each individual's nurse's work in a day. But these are critical steps that are necessary to go from espousing a value to practicing it. You can't ask a nurse taking care of 8 patients to learn lean methodology. Can't happen. So our focus in Philadelphia has been on maintaining catheters. And importantly, all of our house staff and fellows, before they enter the units that this work is ongoing, have to take a module and demonstrate they understand what we're doing. So before the MICU team comes in on their rotation, they got to go through the module. They've got to be indoctrinated to the cultures. They're visitors. They're rotating for 6 weeks. You can't let them come in and not understand your culture. So they got to be indoctrinated. You can't expect them to know it if you don't give them time to learn. So that's what we did. Here's the observation. This is 30 dressing changes in a 90-bed oncology unit, including a bone marrow transplant unit. This is the way nurses did their work at the University of Pennsylvania. I don't know, it's a very big nursing school, lots of smart people. This is the way they did their work. Now, they didn't realize they were doing their work that way. They all thought individually they were doing it the same. It was only when they stepped back and watched one of their colleagues do it and said, why do you do it that way? Now, let's just pick red. Red is the color of an interruption while a nurse is changing a Hickman catheter dressing in a leukemic. Look at this. Red. Process has to start. Yellow step here has to be redone. This is 45 minutes of one nurse's effort changing one dressing. Now, I don't know what nurses get paid in New York, but if I do the math around the waste associated with that, and I multiply it times X number of nurses, and I multiply that times the number of catheters, Caroline did some back-of-the-envelope math this morning, that's where healthcare wastes its resource. Because please explain to me why a smart person would ever do work this way. If you go to Alcoa, there's one way to roll the sheet of aluminum. I would submit to you, changing a dressing is no different. Why do we each need the Richard Shannon methodology for changing a dressing? And when you standardize work, you don't take away freedom. You free the mind to deal with the complexity of this clinical care. So this is what it looks like now. 5 steps, all visual, on every door in every room, reminding the nurse what they need, and the nurses redesigned the dressing kit. They said, here's what we need. In our dressing kit, we need 2 masks, one for the nurse and one for the patient, because these are oncology patients. We need 2 sets of gloves. We need to make sure that we can remove the dressing. We need to make sure that the dressing kit has a bio patch, so I don't have to go fetch the bio patch in another thing. So now 5 clear steps to standardize the work. And what happens? Here's the number of human beings infected on our oncology units before we started the work. On average, 15 people on the 90-bed unit infected every month. Here's what happened since. This is on oncology. People said to me, Dr. Shannon, you can't eliminate infections in patients with cancer. They just get infections. Well, true, that's one, we're close. But here's the overall performance. This is the 363 bloodstream infections we had at the University of Pennsylvania in 2007. There are 13 through the end of the fiscal year 2010. 363 to 13, not 0, but those 13 now constitute a much more manageable opportunity to learn. And this step here, 207 to 208, is just standardizing work. Just giving workers what they need to do their job. That's all this is. Nothing else, no fancy antibiotics, nothing but saying, what do you need to change a dressing properly? And then leaders give it to you.